Good evening, everyone. Okay. Good evening, everyone. Welcome to OET Listening Prowess. And this is Divita Benny from 𝐒𝐿𝐻 Academy. I hope you had a great day and we are back with another live session. So, yes, so how are you guys? Are you all preparing for your exams well? Yes. So today what I'm planning to do is I will be discussing an extract from part A and then we'll be discussing the answers. So I want you to comment your answers. So that's how I'm planning to do. Yes. Okay. So if there is someone who is new here, see last class or last session we discussed regarding the strategies. I hope you were able to apply all those strategies while you attempted the part A. So without any further delay, let's start with the part A. I hope the question is visible for you. Yes. Okay. Good evening, everyone. Yes. So I hope you can see the question. So today, as I already mentioned earlier, we will be discussing on the extract from part A. So from the question itself, it is stating that it is a conversation which is happening between two people. As you know that we have a consultation extract for part A, which can be lasting for at least 4.5 to 5 minutes. And then, so the question is, you hear a physician talking to a new patient called Mrs. Delilah. Hi, good evening, Priyadarshini. Yeah, I'm really glad to see you. So we just started. Yes, coming back. So the patient's name is Delilah. And we are having a conversation with the physician. So for questions 1 to 12, we have to complete the notes with the words or short phrase. So what I'm planning to do is, you can go through the question and we'll be anticipating the answers or predicting the answers all together. And finally, we will be playing the audio and then we'll be discussing the answers. So that's how it is going to be. So yes. Good evening, Jissa. Good evening. Yes. Okay. So the first question, that is, hi Sija, good evening. Okay. So the first question is, persistent mild weakness on the blank space and occasional numbness in the left hand, and we have shortness of breath of it. So please try to anticipate or predict the information that you're planning to include over here. So please try to comment the same and then I'll be explaining regarding what we can actually predict over here. So please do try to make it fast. Okay, so here you can see that as I already mentioned earlier, you have to read the information before and after. Hi Reshma, good evening. Hi Lino, good evening. We just started off. So please try to anticipate the information that is there in the blank spaces. So yes, so persistent mild weakness on the. And also it is very important for you to read the information which is present after the blank space as well, right? So what type of information can you expect over here? So here the blank space is more likely to be filled with a noun and which can describe the location of the weakness. Okay, so I would suggest it is very logical for us to predict the noun here is most probably the leg. Why? Because I think you can see that here left leg is already mentioned over there. So that can be the answer. I'm not telling that it will be the answer, but that can be the answer. Now, that is something we are predicting, right? So how will you retrieve this particular answer over here? So retrieving means finding out the specific information from the audio. So while you listen to the audio, yes, Sija, area. Yeah, that can be a particular body part or the particular place where the patient is experiencing this weakness, right? Okay, you're right. Okay, so now while you listen to the audio, how do you retrieve the particular information? So what you can do is you can try to focus on the body part which is mentioned. So please try to be paying attention to the terms like leg or hand, so which will give you an idea regarding the type of information that you can include over here. I hope it is clear. Yes, Jissa, it is going to be a body part. So we are just predicting the information. Okay. So let's move forward with the next question. Yes, Reshma, any part of hand or leg, you are right. That is right. Any other answer apart from this? Is there anyone having any other answers? Okay. Okay, the next question is, had repeated carotid Dopplers and further imaging studies that showed no further increased stenosis in my left internal, and we have a blank space and is ampullating with the cane. Okay, so now what is going to be the information that you are planning to anticipate over here? I'll give you 3 seconds, try to comment the same. Let's check which is going to be your answer. So what do you think? What can be predicted over here? So here the blank space is likely to be a noun, right? So what type of noun that you can expect over here? So it can describe a part of actually vascular system. Why? Because here we can see they have mentioned a word stenosis, right? So which is actually related to the narrowing of blood vessel. So it actually leads to the conclusion that that is a place where a carotid artery is needed. Okay, so how do you retrieve this particular information? So while you listen, yes, Reshma, veins, okay, that can be. So while you listen to the audio, you can check whether the healthcare profession is actually discussing about anything about imaging studies, or if closely listen for the specific terms which is related to vascular system. Okay, maybe like artery, or especially which is paired with the internal and left. So here you can see internal and left. So you can try to focus. So we can say this is going to be our selector word. I hope you do remember what we discussed last week. A selector is a word which will be helping you to find out a possible answer, right? So here you can see this can be your selector word. While you listen, you can always listen to this particular word. Yes, Sija, it's going to be an organ. Yes, we can anticipate the same thing, right? Now, yes, let's move forward with the next one. So this is going to be past medical surgery, right? So had a cerebrovascular accident and we have a blank space, right? So what do you think here? What can be the particular information that you can add over here? Any idea? Any idea? So it is already clearly mentioned the patient already had a cerebrovascular accident, right? So the blank space again requires a noun or a phrase which will be describing the outcome, or it will be specifying the information related to cerebrovascular accident. So it can be an outcome, right? So the patient had a cerebrovascular accident. അതിനുശേഷം എന്ത് സംഭവിച്ചു അതാണ് അവിടെ ഉദ്ദേശിക്കുന്നത്. So നമ്മൾ എന്തായിരിക്കും ഇവിടെ anticipate ചെയ്യാൻ പോകുന്നത്? What do you think can be the information that you are planning to anticipate or predict over here? Okay, Reshma, we can expect that is going to be a paralysis. We are not sure about it yet. Yes, that is also something. Anything else apart from that? Yeah. So while you listen to the audio, how do you retrieve this particular information? You can listen for additional details which is related to stroke or even this cerebrovascular accident. So including any residual effects which is happening after the accident. Okay. So, or it can be about any subsequent treatment as well. We are not sure about these things, right? Yes, Jissa, it can be about a weakness as well. So you can use these particular details to fill the blanks. That means after the cerebrovascular accident, the patient might have had a treatment, or patient might have had a condition which have made the patient condition a bit more weak. So anything can be expected over here, right? Yes. So now let's move forward with the next question. So we have past surgeries, then we have family history of illness, which is none. Then we have information related to the medications, right? Yes, we have medications. So medications, and again we have two blank spaces here. We have fourth question and fifth question. So what do you think? That's going to be a very easy information that you can predict over there, right? What can be the medications or what can be particular information over here? What do you think? I'll just wait for a few minutes. I would like to get the answer for the same. Yes. So it is mentioned, it is Plavix, then aspirin, and we have a blank space. Yes, Jissa, you're right. It can be a medicine names. 4th and 5th question can be a medicine name, and we have two possible answers over here, right? So the first blank likely needs to be a form of medication, or it can be dosage, or you can say it can also be frequency of the medication. Yes, Reshma, it can be a name of medication. You're right, that's very easy. And also probably the next blank space that we have is also going to be something related to the medications, right? Yes. So how do you retrieve this particular information, or how do you find out? So while listening to the audio, what you can do? Yes, Sobi, CVA medications. Yes, something related to that. Yes. So while you listen, focus on the healthcare professional while they discuss the medication. So here you know that medications are mostly going to be discussed by the physician, right? It is not going to be mostly the Delilah, the patient who is going to speak about it. Patient ആയിരിക്കാൻ സാധ്യതയില്ല മെഡിക്കേഷൻസിനെ പറ്റി പറയാൻ സാധ്യതയുള്ളത് most probably. Again, that is a prediction. That's a probably. We don't know. So the next one is allergies. So it is already mentioned none, right? Now the next one is physical examination. So it is something related to the physical examination. It is mentioned as blood pressure, that is 170/66, and we have heart rate, that is there a blank space. We have weight, temperature. So tell me, what is the information that you'll be predicting? Make it fast. I'm waiting. It is again an easy answer, right? Let's check what we can expect over here. You can expect that it is going to be a numeral, right? Which will be specifying the heart rate. Am I right? Yes, it is a heart rate, which is going to be mentioned in number. Yes, Reshma. Yes, Sobi, that's going to be number. Very good. Thank you for the answers. So how do you retrieve this information, or how do you find out? So while you listen, what you can do? Yes, Jissa, it's going to be a reading of heart rate. Okay, coming back. While you listen, what you can do, when the healthcare professional is mentioning the heart rate, you have to capture the number and you have to write down the answer. I hope it is clear so far. Okay. So the next we are moving forward with the diagnosis, and it is mentioned normocephalic and a traumatic. Okay, then no, we have a blank space, no palpable cervical lymph nodes, conjunctiva and sclera are clear. So what can be the information? What do you think is going to be here? What can be the information? We have a specific, yes, Seja. Heart rate in minute. That was the answer for the previous question, right? Yes, you're right. So what do you think? For the 7th question, what do you think? It is clearly mentioned no. So while you listen to the audio, this blank space is likely to be a noun, which is going to describe something that is not present, right? Why? Because it is clearly mentioned no. So which means any symptoms or any condition, whatever the patient might be experiencing, is not actually present at the moment, right? Okay, so it can be possibly a sign or symptom. We are not sure about it, but it can be. So what do you think? Specific findings. Yes, you're right. It can be a specific finding. Here also it is mentioned no palpable lymph nodes. Yes. Anything else apart from that? Symptoms. Yes, you're right. Symptoms. So how swelling? Yes, we can expect that can be swelling. You're right. Anything else? No inflammation. Yeah. Yes. That can be also a particular answer. Okay, Denny. Yes. Anything else apart from that? Okay, just I was telling that glands or any. So which means there might be something related to again the symptom. Okay, so now how do you retrieve this particular information? So while you listen to the part of diagnosis, you have to be very clear regarding the conversation. So listen for the phrases like maybe they might be mentioning no evidence of, or no signs of, or you can expect something similar expression which is indicating what was checked and is currently absent. So which means the condition might have been, or the symptoms might have been already checked and it is not actually present. Okay, is it clear so far? Okay, now let's move forward to the 8th question. So the next question is, cranial nerves show mild decrease in the left and we have a blank space and that is fault. So what can be the information that you can predict or anticipate over here? Let me know in the comments. Yes. Okay, so here the blank space is likely to be filled with again a noun which can be related to a function or any strength. So what do you think? What do you think? And also specifically it is going to refer something related to the aspect of any cranial nerve function. And again another important the example, or we have another signposting over here is left and fold. So we have to clearly read before the question or before the blank space and after the blank space. So what can be over here? What do you think is here? Cerebral, okay Reshma, it can be cerebral, left cerebral fold, okay, we can expect that. Anything else? Anything else? Okay, so what do you do while you listen to the audio? Left side of some part of body. Yes, Sobi, that can also be expected. It can be something of the left side of the body. Yes, because it is clearly mentioned left. So while you listen to the audio, now how will we retrieve the information? While we listen to the audio, yes, Seja, it can be a side. Yes, that is also true. So while we listen to the audio, what you can do? Do is while they do the cranial nerve examination, yes, just it can be any parts of the left side of parts. Okay, yes. So yes, coming back, what you can do is that while they specifically mention something related to the left side of a fold, clearly or keenly observe for the answer. That can help you to get the answer. Okay. Then again we have a next question. There is a mild increase and we have a blank space in the left upper extremity. So, yes, tell me the answer or what you can predict in this particular blank space. What do you think? It is mentioned regarding mild increase. So, it can be pain or something else. What do you think? And we have in the left upper extremity. So something which is there in the left upper extremity. What do you think? Okay, so the blank likely requires most probably a noun and which is related to any clinical sign, maybe such as muscle torn, or we can expect it is going to be a spasticity, anything related to that. What do you think? What are you predicting? I'm predicting that it can be something related to the muscle tone. So, yes, swelling or weakness, maybe, yes, you're right. Mild increase and we have a blank space. Anything else apart from that? Swollen, okay, Sarika, yes, you're right. Anything else? Symptoms, yes, Sija. So we have three anticipation right now. It can be swollen, Yes, Reshma, it can be swollen or symptoms or something related to swelling or weakness. So while you listen to the particular part of information, what you can do, you can listen for the terms which is actually describing the changes in the muscle tone or any neurological function. So closely observe something which is mentioned. Okay. Okay, I hope it is clear so far. Then the next question is the 10th one. Deltoid shows 5/5 and the test showed full strength, and we have again a blank space is 5/5 on left. So what do you think is going to be the answer over here? What can you anticipate here? Is there any particular information that you are anticipating here? Let's wait for the answers. Okay. All right. So here the blank space might require a noun which indicates what was tested. Okay. And the context is suggesting that it can be a measure of a strength, or maybe it can particularly specify a muscle group or function. We are not about it. Yes, Reshma. It can be any muscle. You're right. You're right. Anything else? Anything else? Okay. Just yes, muscle tone. Yes, you can expect a muscle tone over there. Something related to any muscle tone or anything which is having this 5/5 on the left side. Again, we have another information that is left side, right? See, so you have to you have this keyword over there. Okay, so while you retrieve the information, what you can do, you can closely observe while they describe any strength testing, or focus on that particular muscle groups or function that is tested, which can help you to an extent. Now let's move forward with the next question. We have the 11th question. Yes, extending into the dashed with a mild left hemiparesis has been clinically stable with mild improvement. So what can be the information that you can predict over here? Let me just wait for your answer. What you can predict over here? We have a mild left hemiparesis. It is mentioned it is clinically stable, and particularly we have a word extending. So something is extending. So we have a bit of information which can give you an idea. What will you add here? Symptom. Sadiga. Yes, it can be a symptom. Anything else? So here it can be, see, the blank is going, space is likely to be, violet is telling it's a number. Yes, it can be a number. Okay, so here the blank is likely requires, likely requires a noun which is related to a part of particularly a brain or nervous system, because given the context, hemiparesis, some, yes, Sabi, you're right, some left to right brain parts. So the nervous system, or as I already mentioned, left hemiparesis. So something related to the brain, or so we can particularly listen to the particular information which is going to be there. Okay, that's the most accurate answers. Okay. Now the last question. Any parts? Guess Jifa. Okay, the last question, we have further treatment. So basically they are going to focus on the further treatment. So continue with, and we have reducing oxygen supply in brain. Reshma. Okay, so again something related to brain. That is right. So let's move forward with the next question. Continue with a blank space to reduce the risk of further strokes. What can be used to reduce the risk of strokes? What can be reduced? Tell me what we can do. So it is about something related to the treatment. So you can have an idea. It is going to be mentioned related to the treatment, right? Medication, medicine. Yes, Banu. Yes, Jasa. You're right. It's going to be a medication. Anything else? So yes, let's try to understand here. Treatment plan, Sobi. Yes, okay. Okay. So here the blank is likely to be filled with a noun which is related to a treatment or any intervention. It also is suggesting that it's going to be an ongoing or any recommended treat plan. So while you listen, how do you retrieve this particular information while you listen to the audio? Listen to the discussion on any future plans which is happening between both of them or any recommendations, and the keywords might include specific therapies or it can be type of the medications aimed at preventing strokes. So you have the keyword here, that is strokes here. Okay, so listen which is something related to the strokes. Okay, any hard mass. Okay, medications. Yes. So now that we have discussed the whole questions, we will play the audio so that you can anticipate and write the information. So please ensure to read the entire questions during the 30 seconds that is provided, and you can start reading your question before they start the instructions. You can use that time. As I already mentioned the same thing during the last session, you can include that particular 10 second to 5 second for you to read it. So as we have anticipated, you do have the idea. So I think we can play the audio. Yes, I'll be playing the audio for you. So please make sure that you're having a paper and pencil and do write the answers, and we'll be discussing. Yes, let's play the audio.
Occupational English test. Practice test
8.
Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1. Extract 1, questions 1 to 12.
You hear a physician talking to a new patient called Mrs. Delilah.
For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, doctor.
Good morning. Any allergies due to medications? A history of illness of your family members?
No, doctor.
Well, your blood pressure is 170/66, heart rate 66, respiratory rate 16. Your weight is 254 pounds, and your temperature is 98. Normal cephalic and atraumatic. No dry mouth, no palpable cervical lymph nodes. Your conjunctiva and sclera were clear. Your cranial nerves show mild decrease in the left nasolabial fold. There is a mild increased tone in the left upper extremity. Deltoid shows 5/5. The rest shows full strength. Hip flexion is 5/5 on the left. The rest shows full strength. Reflexes were hypoactive and symmetrical. Your gait is mildly abnormal. No ataxia noted. Wide-based, ambulated with a cane. Status, post-cerebrovascular accident involving the right upper pons extending into the right cerebral pedicle, with a mild left hemiparenthesis. Status, post-cerebrovascular accident involving the right upper pons extending into the right cerebral peduncle, with a mild left hemiparesis, has been clinically stable with mild improvement. For now, continue using antiplatelet therapy and statin therapy to reduce the risk of future strokes. Continue to follow with endocrinology for diabetes and thyroid problems. You must strictly control your blood sugar level, optimizing cholesterol and blood pressure control, regular exercise, and healthy diet. I am planning for surgical intervention for the internal carotid artery.
Or did you find it difficult? നമ്മളിപ്പം ഡിസ്കസ് ചെയ്ത പോലെയൊക്കെ ആഡ് ചെയ്യാൻ പറ്റിയോ ഇൻഫർമേഷൻസ് എങ്ങനെയുണ്ടായിരുന്നു എളുപ്പമായിരുന്നോ I think it might be a bit easy because we just anticipated every other information, right? Okay, so shall we discuss the answers now? I'll be reading it out the correct answers. You can write down and yes, then we will discuss further. Okay. So yes, the first question's answer was left leg. I think we anticipated it very almost near to the correct answer, right? Okay. So the second answer was carotid artery. CAROTID, carotid artery. The third question's answer was treated. And fourth one was levothyroxine. Then fifth one, simvastatin. Sixth one is 66. Sixth question answer is 66. Then, yes. Seventh one is dry mouth. Seventh one's answer is dry mouth. Okay, eighth one, nasolabial. Nasolabial, NASOLABIAL. Nasolabial. Then ninth one is tone. It is tone. Now, 10th one, that is hip flexion. Hip flexion. FLEXION. It is hip flexion. 11 is peduncle. It is peduncle. PEDUNCLE. And final one, that is 12th one, is antiplatelet therapy and statin therapy. Antiplatelet therapy and statin therapy. Do you want me to read the answers again? Were you able to get the answers? So please do count and let me know in the comments how much you are able to score. It was 12 questions, so I would like to know how much were you able to score. Yes, let's check how many of you got 12 out of 10. 12. So make sure that you are always able to, score properly for the part A, as we just mentioned earlier as well. Part A is a bit more easy for you to get the correct answers. So yes, let's check how many of you got 12 out of 12. Yes. എല്ലാവർക്കും ഫുള്ളായിരുന്നോ കിട്ടിയോ? 12 ആൻസേഴ്സും കിട്ടിയോ? It was easy, right? Are you guys still counting? Yes, Reshma, let me know how much were you able to score? Were you able to get 12 out of 12? Okay. So I hope you were able to get the answers properly. So be 8 out of 12. Okay, you are not able to hear the first 2-3 questions. That is fine, but still 8 out of 12 is a good score for you to get first extract. Good. Others, Violet, let me know the how much were you able to score. Okay, I'll just wait for a few minutes as well, as those are just, I think they are still counting. Let's wait. Okay, do mention in the comments. Okay, so now I'll just forward with the transcript so that we will have an idea regarding where this particular answer was located. Okay, I hope it is clear for you. So this was the particular transcript. So occupational English test, practice test 8, the listening test. This test has 3 parts. In each part you'll hear a number of different extracts. At the start of each extract you will hear the sound and you will have time to read the questions before you hear each extract, and you will hear each extract once only. Complete your answers as you listen. At the end of the test you will have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. So these was the particular instructions that you are able to hear. As we have mentioned earlier, please ensure that you are reading your questions during this particular time. Now let's move forward. You have questions 1 to 24. Complete the notes with information you hear. Now look at the notes for extract 1. Extract 1, we have questions 1 to 12, and you hear a physician talking to a new patient called Mrs. Delilah. For questions 1 to 12, complete the notes with a word or short phrase. We are aware that you are only needing the answer is a word or short phrase, and we have 30 seconds to look at the notes. So this was the particular conversation that was happening, right? Jissa got 9 out of 12. Good job, Jissa. Okay. So patient. Good morning, doctor. Doctor. Good morning. What is your problem? So Delilah. Well, I have a persistent mild weakness in the left leg and occasional off and on numbness in the left hand. I have shortness of breath often. So what was our first question? The first question was the patient persistent mild weakness on the blank space. So it was left leg. Okay, I have highlighted the correct answers. You can go through it. Then the next question was about, do you feel any weakness in your arm? So the patient's answer to that was a no, but patient is able to ambulate with the cane. So the next question from the doctor was there any history of falling down? Again, the answer from the patient was no, doctor. I had repeated carotid Dopplers and my further imaging studies showed no further increased stenosis in my left internal carotid artery. I think most of you were able to anticipate the right answers. Good job, guys, because it is clearly mentioned that it is something related to stenosis and